Good afternoon, good morning. This is Dr. Eunice. I will be discussing narcissistic personality disorder. Obviously, this is a disorder that is talked a lot about. Um, a lot of people talk about this disorder. They call somebody they hate or somebody they think that is a narcissistic. But what does a narcissistic person look like or act like? Someone who has these symptoms. Um, you know, so narcissistic personality disorder is a mental health condition. It is characterized by a perversive pattern of grandiosity. So this person has grandiosity, has needs for admiration, lack empathy, they're boastful, um, and obviously we know that it does impact their functionality or their daily functions as well as relationships. So we're going to go ahead and describe what really grandiosity means. So grandiosity is actually the hallmark feature of narcissistic personality disorder. It involves exaggerated sense of self, importance, or superiority. So somebody who feels like, if you have a boss or a colleague who is constantly bragging about their achievements, belittle others' accomplishments, and of course insist on being the center of attention during the work meetings, study groups, believing they are inherently superior than anyone else around them. So that's what grandiosity looks like. So the need for admiration is an individual is going to have a strong need for admiration and validation from others. They seek constant praise and attention. They want because they want to maintain their self-esteem high. So they do have a fragile or vulnerable self-esteem, and the need for admiration is the one that is supposed to take care of that. So so imagine a friend who is constantly posting their selfies on social media, Facebook, Instagram, and they're always fishing for compliments and likes. And I'm not saying that you don't like my video. I really want you to like my video. I want you to comment. I want you to subscribe. But this, the value of social media or telling people to like your content, if especially if it's educational, like this one I'm doing, or other social media now, you remember that people are usually paid because of those likes. It's not what you're talking about here. We're talking about a combination of these symptoms. So if somebody gets upset or feels like they have to withdraw if they don't receive the desired level of attention and admiration, that is a characteristic for narcissistic personality disorder. So the other part of the symptoms is lack of empathy. Okay, so lack of empathy is also a key characteristic for a narcissistic personality disorder. So individuals that are struggling with NPD will struggle to recognize other people. They fail to recognize or understand what other people are feeling or their needs are. I ignore them. So again, an example of a boss or even like a marital partner or a boyfriend that is constantly dismissing the concerns that you are raising as their friend or as their employee, um, and they don't show any concern or show very little concern for your well-being. If you have complaints that you have raised and they don't seem to care, they prioritize on their own interest. Like they really care about the production, they care about what the work that you're doing because it's increasing their sales, and that's it. But they don't have any regard for other people. So So that's what summarizes the narcissistic personality disorder symptoms. Of course, someone who is constantly boastful, has conceited demeanor, is going to be categorized as having narcissistic personality disorder. Impact on daily life, definitely a narcissistic personality disorder patient has, these symptoms are going to definitely impact their daily functioning. The symptoms are going to um, influence or determine what type of relationships they're going to have. You have relationships breaking up all the time. Overall quality of life is poor. It leads to difficulties in forming new relationships or keeping old relationships because they don't have value for other people and they don't show empathy, which is a very good ingredient for keeping genuine relationships. So even at workplace, at school, in their home, they'll be suffering. They will have, their emotional well-being is going to be impacted definitely by these symptoms. So individuals that are struggling with NPD, as I say, they will struggle to maintain meaningful relationships, and that includes parental or even marital relationships. So don't get me wrong, I'm not just talking about workers, I'm talking about including workplaces, even church, even at home, even neighbors, because they have this huge, strong self centeredness and they manipulate their way, they lack empathy, and all these things. When people realize the kind of people they are, they're going to hurt feelings and they might be left alone, and that might lead to loneliness of the client. The client might become lonely. There's always a lot of conflict around them, always fighting, whether it's at home, at school, at work. For example, a romantic partner may feel constantly invalidated and unappreciated by their narcissistic partner, and that might result to a lot of arguments at home that will cause emotional distress for either one of them. For some of the people that have had a narcissistic person or somebody who has this disorder in their home, they do know how much it can, how straining as it is to really work or try to work through the process of, just having a positive relationship with such a person. So for treatment, we're gonna look at psychotherapy. So an NPD typically just involves psychotherapy that will be aimed at creating self-awareness, improving interpersonal skills for the person that is having the disorder, and obviously addressing any underlying insecurities or vulnerabilities that might be underlying that cause this person to have these symptoms. Obviously, the person may enter therapy after experiencing a series of failed relationships or conflict in workplace. They may seek help to understand why they struggle to maintain meaningful connections and how they can develop healthier patterns of relating to others. If somebody is having these symptoms, most likely they will not even see their failure. They will not see like they have any fault. So someone else might have to point out to them. So it's definitely going to take a lot of support. Their support system might be the ones that bring them to therapy. In terms of medication, there is no known medication for NPD, but there might be medications that will be prescribed based on the mental health professional that works with the client who is licensed to do medication. But mostly the medication is going to be targeting some of those underlying symptoms or co-occurring symptoms, such as someone who is lonely, who doesn't have relationships, most likely is going to be depressed, dealing with impulsivity or anxiety. That might require maybe prescribed antidepressants that alleviate those symptoms, such as depression, and also mood stabilizers to just manage their mood swings. So it is very important that you understand these symptoms. If you are doing this for exam, this is really what I have summarized from DSM-5 TR. I wish you all the best. I am also studying this for an exam and also for just so that I can know how to, most of the times, not really evaluate a client, but have an idea of when I see the symptoms, what are we looking at before we even start checking what is in DSM-5 and how we can categorize them for treatment. So, again, as I have said, this is not a diagnostic procedure. This is for academic or study alone. So thank you for so much for following me. Thank you for subscribing. Thank you for liking my video. Thank you for sharing this video. I will come back and most likely bring this topic again, even to give my own experience dealing with someone who has NPD in my life as a child. And that might probably help someone to understand how NPD manifests in families and even in marital relationships. Of course, I will be back. Thank you very much, and thank you for watching.